Ever wondered why stroke is often referred to as a silent killer? It's because it strikes when you least expect it, and its effects can be devastating. A stroke is characterized by the sudden onset of neurological deficits, rooted in a vascular basis, leading to the infarction of central nervous system tissue. In simpler terms, it's a sudden blockage of blood flow to the brain resulting in permanent tissue injury. On the other hand, we have what's termed as a transient ischemic attack, or TIA. This bears similar characteristics to a stroke, but without infarction. The damage is not permanent. Strokes fall into two major categories: ischemic, accounting for roughly 80% of cases, and hemorrhagic, making up the remaining 20%. Now that we've defined stroke and its two major types, let's delve deeper into the pathophysiology of each. Ischemic stroke is the more common type, accounting for about 80% of all strokes. It's mainly divided into three subtypes, each with its own unique mechanisms. First, we have arterial thrombosis. This is where a clot, or thrombus, forms within an artery. This can happen locally, right at the spot where the blood flow is obstructed. Large vessels like the internal carotid artery, vertebral or intracranial arteries are often involved. The underlying processes here are usually atherosclerosis, dissection, and vasculitis. Essentially, when blood flow is insufficient beyond the lesion, we get what's termed a hemodynamic stroke. Next up is the small vessel or lacunar type of ischemic stroke. Chronic conditions like hypertension and diabetes play a big role here as they cause vessel wall thickening and reduce the luminal diameter. This subtype primarily affects small penetrating arteries, like those found in the basal ganglia, internal capsule, and thalamus. The second subtype of ischemic stroke is cardioembolic. This is when particles originating from the heart block the cerebral arterial blood flow. Conditions like atrial fibrillation, rheumatic valve disease, prosthetic heart valves, and recent myocardial infarction can cause this. Even infectious endocarditis can be a culprit. Finally, we have systemic hypoperfusion, also known as global cerebral ischemia. This occurs when the brain doesn't receive adequate blood flow, usually secondary to cardiac pump failure. This can happen due to cardiac arrest, arrhythmia, or a myocardial infarction. It primarily affects watershed areas, which are the regions between the major cerebral arterial territories. Understanding the pathophysiology of ischemic stroke is crucial in its prevention and management. Now let's turn our attention to hemorrhagic stroke. Although less common, hemorrhagic stroke is often more severe and has a higher mortality rate. Hemorrhagic stroke occurs when there is bleeding in the brain, disrupting the normal flow of blood and depriving brain cells of oxygen and nutrients. There are two main subtypes of hemorrhagic stroke: intracerebral hemorrhage and subarachnoid hemorrhage. Intracerebral hemorrhage happens when a blood vessel within the brain bursts, typically due to hypertension. This leads to the formation of small microaneurysms, also known as Charcot-Bouchard aneurysms, that rupture, causing blood to spill into the surrounding brain tissue. This can occur in various locations within the brain, but the most common sites are the putamen, thalamus, cerebellum, and pons. Other triggers for intracerebral hemorrhage can include trauma, vascular malformations, and even certain drug use, like cocaine or amphetamines. On the other hand, subarachnoid hemorrhage is when bleeding occurs in the space between the brain and the surrounding membrane. This can lead to a sudden, severe headache, often described as the worst headache of one's life, and requires immediate medical attention. In both cases, the bleeding causes an increase in pressure within the skull, which can lead to serious complications, including brain damage, coma, or even death. Hemorrhagic stroke is a medical emergency that requires immediate attention. The better we understand its pathophysiology, the more effectively we can treat it. In the past few minutes, we've explored the complex pathophysiology of stroke. We've learned that stroke is a sudden onset of neurological deficits caused by infarction or tissue injury. There are two major types: ischemic and hemorrhagic, each with their own unique mechanisms. Understanding these mechanisms, from arterial thrombosis and cardioembolic events in ischemic strokes, to hypertensive and trauma-induced hemorrhages in hemorrhagic strokes, is crucial in stroke prevention and management. Remember, the more we understand about stroke, the better equipped we are to prevent and manage it. Thanks for watching, and stay informed. That's it for today's video on stroke pathophysiology. We hope that the information provided has given you a deeper understanding of the subject. If you found this video helpful and want to join our community, please subscribe now. It's your support that encourages us to bring more interesting, challenging, and high-quality videos to everyone. Our channel, Medicine Health 360, is dedicated to providing crucial, latest, and systemic medical and health knowledge with a simple approach to everyone. Our aim? To help you lead a better and healthier life. We'd love to hear your thoughts, so don't forget to leave a comment below. Give us a thumbs up if you learned something today. Thanks for watching, and remember, stay healthy.